Yeah, so good afternoon. It's great to be here. Just want to say thank you to the organisers and to Dr. Chesko for having me. So depression is one of the predominant mental health problems worldwide, followed by anxiety, schizophrenia, and bipolar disorder. And during lockdown, depression has heightened. It's a normal reaction to an abnormal situation. So is there anything that we can do about it? So today I'm going to be deconstructing what is depression, sharing some research, and looking at ways of how we can work with depression, looking at it from a mainstream as well as an Islamic perspective. I'm Ayesha Aslam, the founder of Sakoon Councelling Services. We're an organization that combines mainstream therapy and we integrate culture and faith during treatment. I actually set up Sakoon Councelling Services in 2006 with the view of not wanting to compromise faith. I remember studying psychology many years ago, and I was always told you can't mix faith in treatment. And it just never really sat with me at all. And I did a lot of research, and I was very fortunate enough to work with Asian women. And I noticed that culture and faith was a very dominant theme in our counselling sessions that could not be ignored. So I decided to go against the mainstream perspective, and I devised my own model, the Sakoon model. Last year, I was actually invited by BACP, the British Association of Counselling and Psychotherapy, and CPCAB, the largest counselling organisations in the UK, to talk about the Sakoon model, wanting to know how we integrate faith, how we talk about diversity in our services. So it's actually really nice to see that shift, that change taking place within the counselling industry, in the sense of being a bit more open and fluid to differences and different ways of working. So I actually set up Sakoon with the view of not wanting to make a difference in communities. I wanted to change the stigma of mental health and people's views towards counselling. I wanted people to know that they can talk about their problems, that they don't have to suffer in silence. But most importantly, that it's Islamic to talk in a confidential setting. So I wanted to address these myths, but I wanted to create that safe space to empower people to live better lives. So fast forward to date, we work with individuals, couples, and families. We have a team of over 10 therapists. We work with all cultures, all communities, and all faiths and non-faiths. We also have offices in Manchester, Birmingham, and London in the UK. But we also work worldwide. We have clients as far as Australia, Indonesia, in the UAE. And the reason for that is that a lot of people want to have a professional service and someone who can connect with their culture, who can connect with spirituality. As well as offering counselling, we also have a number of other projects in the background. We deliver accredited counselling courses, and all of our courses, they are worldwide recognised. All of our learners, we teach them how to integrate diversity and faith when they're working with clients. Before lockdown, we were actually delivering counselling course in Dubai. We also train organisations internationally and nationally, and I was delivering Islamic counselling in Thailand. And we work in partnership. We have volunteers on board. And I'm also part of the Global Mental Health Summit, driving policy change when it comes to mental health. We also educate the community by delivering talks, doing articles, having podcasts, and it's all on our sort of website and our details. 1 in 4 people suffer from a mental health problem worldwide, and that's equivalent to splitting the room into 4. And over 75% of people will have a mental health concern by the time they reach the age of 18, 3/4 of a room. And 50% by the time they become an adult. So these statistics are actually quite worrying and alarming, and unfortunately it is on the increase that many speakers have talked about. But one of the secrets to positive mental health is support. So when we just sort of break it down a little bit, when we understand what is mental health, World Health Organization define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So mental health is really looking at one's overall daily functioning. It's looking at the way it affects one's way of thinking, how they feel, how they behave, how they handle stress, how they relate to others, how they make choices. And when it comes to mental health, it impacts everybody at every stage of development, whether you're a child, an adolescent, an adult, elderly, regardless of gender or culture, it impacts us all. And as we already know, there's so many different types of mental health concerns across the spectrum. And when we think a little bit about the experience that we're all going through, we're all facing this world crisis of COVID-19. There is research by the Royal College of Psychiatrists that have observed and shared that men aged between the 18 and 25, there has been an increase in first-time mental health issues. So why is that the case? This is sort of the first time in this sort of period where there is chronic stress taking place, where people are being isolated. There is job insecurities, relationship breakdowns, bereavement, loss. It's causing a lot of increase in trouble sleeping. People are becoming really worried. They're not certain about their future or their security for what's going to come. And that's the sort of situation, that's the climate that we're in. There's not much we can really do about that. So we're facing this sort of concept known as lockdown anxiety, where all of us, many of us, have this fear of contracting COVID-19 that's invisible to the eye. We're also being cut off and restrained, refrained from being able to see our friends and family, not having that sort of normal way of socializing. There's also disruptions to NHS and hospital services. And all of this increases in worry within us, that we don't have that security, we don't have that way of that support that we had, that lifestyle that we were living. It's become very different. There has been an increase of behavioral difficulties in children, and this has also been mentioned. And it's that idea of change. When we go through change, it impacts all of us, but it also affects our children, which sometimes tends to be ignored. And like mentioned, there is that idea of we sometimes can misdiagnose. So children do agree, they may shout, and that's part of childish behavior. Same with adolescents, they might become a little bit more reserved or distant from their families, or they may become quite difficult with their behavior. Again, that's very normal, but there's this sort of spectrum of what is normal, and then when does it go into that sort of boundary of when it starts to become a concern. And it's that idea of when it starts to be persistent and it's not sort of shifting, that's a raise and a call for concern. And I remember my son, he's only 4, and he's already still saying to me, "Mummy, I really miss nursery. When can I go see my friends?" And he talks about the word coronavirus. So children feel it at such a young age. They know that something's going on. They may not be able to grasp the full concept, but they understand, they get that something's happening. It's not the same, and children thrive on routine. And as Dr. Vaknin mentioned, there is an expectancy of tsunami of people who need treatment when restrictions ease, and we can see that actually happening. I've been doing a number of talks within the community, and there is this really raised concern about what's going to happen. How can we handle this sort of increase in mental health concerns? We're noticing a backlog of appointments for people to go to the hospital. It's all being sort of taken back. There is an increase of cancer as well, where people are not aware of that happening. So there's also these physical issues, but then there's also this impact of mentally, how all of these changes are having an effect on us and having to sort of manage this on our own and not getting that support. So when we think a little bit about depression, what is it? So it's defined as a mood disorder. It's where somebody has this feeling of being feeling extremely low and sad, and it's persistent. It's associated with hopelessness, inadequacy. It disturbs a person mentally. They're not able to concentrate. They lack energy. They don't feel active. They have that loss of interest. Things that they used to enjoy, they don't enjoy anymore. Things that they used to do, they don't do anymore. And it's this real internal struggle that they have to face. And it doesn't just affect them, it also affects their relationships with others. And when we look at it from a neurological perspective, There is research to show that depression impacts one's neuroplasticity, this idea of the brain's ability to grow new neural connections, this idea of being able to adapt to change, being able to manage new experiences. So someone who's going through depression, they really struggle with change. So when you think about lockdown, the sort of changes that we've had to go through, it really is a real struggle. It's real difficult for them to manage that change, as well as just the average person. We've gone through a lot of different experiences. I'm imagining each and every one of us can share a story about how it was for us. But there's also research to show that when someone is going through depression, there are higher activity levels within the limbic system, in particular the amygdala in the brain that's responsible for emotion. So sadness and low moods become heightened. And there's smaller activity levels within the hippocampus that's responsible for memory. So depression really stops us from being able to focus and to concentrate or to memorize things. And there's an increase in cortisol, the stress hormone, that impacts our overall well-being. So when we look a little bit at Islam in mental health, mental health was actually very advanced in the early years of the Islamic world, and in particular in the Golden Age between the 7th and 13th century. Muslims discovered psychology, psychiatry, psychotherapy. Ibn Sina, also known as Avicenna, a Persian polymath, a Razi, a physician and a philosopher, they actually saw the connection between physical sickness and the psychological well-being. So if you had a physical pain within your body, they would also see that that association could be connected to how you may feel, or vice versa, how you might feel. So if you're feeling quite down, it can also physically have an impact on one's body. And they viewed mental health as an illness and not a disease. And it was in 705 CE that they set up the very first psychiatric hospital in Baghdad. So research used to say that religion is detached to psychology and science, but there is current research to show that Islamic practices does have a direct effect on cognitive functions of the brain. Dr. Andrew Newberg, he did a study where he looked at brain image scans, and he looked at someone who was engaging in prayer and one who wasn't engaging in prayer. And what he noticed is that there was greater activity levels in the frontal lobe when someone was engaged in prayer that is responsible for concentration and focus. So what does this tell us? So what it basically says is that when you do engage in prayers or sort of relaxation activities, meditation, you get better concentration levels. It improves upon BDNF, the brain-derived neurotrophic factor, a growth factor, which helps to improve on plasticity, to be able to adapt to change better. There's also another study where people engaged in a religious activity or meditation for about 30 minutes a day for 8 weeks, and they measured the grey matter part of the brain associated with memory and stress. And these scans were taken before and after. And what it showed is that there was an increase in the grey matter in the hippocampus, which is responsible for learning and memory. So there was that people were able to be more focused, more able to learn, and it was a lot more easy for them. And there was a reduction in the grey matter in the amygdala, which is connected to anxiety and stress. So they were able to manage their emotions better. And the group that didn't practice meditation or religious activity, they didn't show any change within the brain. So what we can see is when you are in that sort of stressed position, it has an impact on us physically and emotionally. Our heart rate increases, our blood pressure rises, where anxiety or depression becomes more prevalent. We may have difficulty sleeping. It impacts on our libido levels, our digestion as well. So it has an impact on us on so many different levels. But when you sort of evoke a relaxation response and you're sort of focusing on mindfulness skills, or you're praying, or you're meditating, you're doing something spiritual, it helps a person physically and emotionally. It helps to reduce the heart rate, reduce one's blood pressure. It improves an immune system. It helps with your sleep and your libido levels, and you feel a lot more better within yourself. So what can we do in this new normal that we're in? So what we've got to understand is that in this situation that we're in, we've all had to juggle all these different roles in one physical confined space. And that in itself is extremely stressful. And what is so important is that we've got to organize our space. So for example, if you're using the kitchen table as your space for work, you've also got to use that table to eat your breakfast, have your lunch, have your dinner. So it's so important to create that environment and make that space. Have separate spaces to do different things. So if you wanted to do exercise, put yourself in that position, get into that role, and have a space where you know that that's where you're going to focus and you're going to work on that. When it comes to dinner time, set up the table, have that time where you're with your family and you really engage in that aspect of your life rather than it all just being one, because that in itself just creates a lot of stress for a person and you feel very messy. If you are going through that transitional process and you are starting to go back to work, you're going out, it's also really important to establish routines. So when you do establish these routines, it's also important to have them safety measures, so socially distancing, putting on the gloves, washing your hands, all of these sorts of things will be really helpful for you. And the key aspect also is about accepting this change. So rather than why is this happening, it's really important that we just adjust to this new normal. And research has shown that this helps us cope far better. We've also got to check in on ourselves. So looking at how you feel is so important, the idea of self-care. So exploring what your triggers might be. So when you go on the media and you're listening to the news, does that help you or does it hinder you? Do you feel more anxious and depressed, or does it make you feel a bit more practical and that you're able to get out and do what you need to do? And what about being at home? What does being at home mean for some people? For some, it's absolutely a bliss because you get to have that more time to be doing the things that you never get the chance to do. You get to spend more quality time with your children. But for other people, it can be extremely frustrating, and not having that sort of space to do the things that you want to do can be extremely difficult to handle. But when we're in this situation, it's not all negative. We've got to think about the positives of the situation. Crises actually bring people together, and it's been so beautiful to see the support, the compassion, the kindness, and this is creating better communities. A Canadian psychologist talked about that this past century, human life has actually been focusing so much on money and materialism that it's led to that neglect of human relationships. And during lockdown, being in lockdown, having to be at home, we're having to survive by having to interact with others. So we're going back to the basics of just communication about these values and bringing that back into life. These are just some other examples of other forms of treatment to help one who is going through low mood. Knowledge is power. Understanding depression, it will help you to have more control rather than feeling controlled. Be a bit more active, sort of write down your thoughts, have a diary, and understanding what's going on for you. Notice your positive qualities. Unfortunately, we live in a society where we always focus on the negatives. That's what attracts attention, but we need to focus on the positives, and that will help us to have a positive mindset. You are what you eat, so you've got to think a lot about what you eat, and we know there's so much research to show if you eat a lot of junk food, you end up getting more lethargic, fatigue, having low moods, and it has a sort of a negative toll on your well-being. But eating healthy food, it makes you feel more active, you feel good about yourself, and you've got more energy. Support, as I mentioned, reach out to your loved ones or to those who are professionals that can help you. And I put some Islamic terms, sabr, which is patience, salah, which means prayer, and zikr, just the remembrance of God. The idea of spirituality and mindfulness really helps the person to feel a little bit more calmer. And there's a lot of self-help guides on our website that talks to you about depression, so please do check it out. So I just wanted to end with an image. What you can see is this man on top of the cliff, and he doesn't know that there's a snake underneath him that's trying to harm the woman. And then there's this woman who's trying to get up on the cliff, And she doesn't know that there's this huge rock on top of the man. And the man's thinking, I'm in so much pain and I'm trying to rescue this woman. I'm trying to pull her up, but why can't she not use a bit of her strength? And the woman's thinking, this snake is really attacking me and I need this man to just pull me up. Why can't he use a bit more of his strength? So the moral of this story is that you can't see the pressure or the problems that people face, the pain that they're going through. Depression is an internal struggle, and the key to positive mental health is support, not judging a person. And what we've got to also remember is depression is not an individual issue, it's also a social issue. I just wanted to end with one just sort of case example that I had. There was a young girl who was about 18 and she had an eating disorder. So she was told by her GP she's not able to fast during Ramadan. And Ramadan is one of our key aspects of Islam. You've got to fast for 30 days. It just happened just over a month ago. So she was going through this routine of starting to eat on time, and she had to maintain the eating at particular times. And by fasting, she wouldn't be able to do that. And when she told her parents and she told her aunties and her uncles, there was this very judgmental attitude, but it's the same if you don't fast. The doctors don't understand, it's a religious requirement. So she felt this pressure, and her dominant discourse was to do with her family, wanting to please them. So she ended up fasting, and she didn't stick to her routine, and she ended up collapsing. She almost died. So this idea of, when it comes to our communities, when it comes to other people, we need to educate ourselves. We also need